We've been looking at some of the sessions taking place during EASD Live and talking to the chairs of those sessions to give us a flavour of what was discussed. And I'm delighted to welcome Andreas Pfeiffer. Andreas Pfeiffer comes from Berlin, and you chaired the very intriguingly titled "You Are What You Eat" session. So tell us, what were the things that you came away with?
Well, it was really an excellent session which had very diverse and very interesting, very novel impacts. Perhaps the most simple but very important one was a study about vitamin D and the incidence of type 2 diabetes, which is seen in the epidemiological studies like Nurses' Health Study as a very powerful factor decreasing the incidence of diabetes by almost 50%. And so Dr. Pitters from Harvard did a study with over 4,000 people and looked for diabetes incidence, and actually there was no significant effect of vitamin D.
And what kind of dose was that?
And this was with 4,000 units, so
wow.
It's a very high dose
that's
he's
a
recommending.
Big dose.
So, well, it's a hormone and much helps, much sometimes. But in this case, he did not see any effect, and he also published that cardiovascular and cancer outcomes are not changed by that dose.
The vitamin D story, though, is one that seems to run and run. It never, you never quite get it back in its box. It's out for another
Yes.
airing.
But here also the critique is that the levels of vitamin D in this American population were in the normal range, the recommended range on average at baseline. So if you do a sub-analysis, which is statistically not without problems because of potential bias, then you see people who had really low levels, they did profit, and this substantially decreased type 2 diabetes. And vitamin D deficiency is very frequent. And in fact, in our countries all over, about half of the people in wintertime have vitamin D deficiency. So it might be important, but the trial in a way might have selected people with low vitamin D levels to see a statistically significant randomized prospective effect.
But we've always had low vitamin D in winter. In other words, this is not a new thing, it's always been there, and yet we've seen a big rise in diabetes. So vitamin D can't be the whole story.
It is probably a protective factor which might help, or which helps if you are deficient, or it increases the risk if you are deficient. But there are other factors which are more important, and one of them is certainly obesity and too much of good food. So this was another interesting story there, and this is about protein. So the world is very divided about protein. Here was Luigi Fontana from Australia, who recommends a low protein diet and says you will live longer because worms and mice and flies live longer if they have low protein diets.
But they don't have a lot of fun, worms and mice and flies.
But I think humans are long-lived. And actually, there are some studies which say if you get older, you need more protein, you will even live longer, epidemiological studies. And so here, and one of the guilty parts of protein is branched-chain amino acids, which play an important role in insulin sensitivity, and leucin is, together with insulin, one which activates the so-called mTOR pathway, which drives mitochondrial biogenesis, but also insulin resistance. If you want to grow and get stronger, you need a lot of mTOR. But if you are obese, it may not be so good. So they tested what happens when you give people either a branched-chain amino acid reduced diet or high branched-chain amino acids on insulin resistance. And if you infuse those amino acids, you can induce insulin resistance and activate this mTOR pathway. And even though they could reduce branched-chain amino acids with that oral intake over several days by 60%, they did not see any change in insulin sensitivity. And which shows that under nutritional conditions, when you do not infuse these amino acids, these effects are actually not so clear. And if you look at the data which look at high protein and low protein diets, there are entirely opposite papers with positive outcomes for instance, for people with diabetes, of better blood sugar, better insulin sensitivity, lower uric acid levels. We also see that in our trials, even with animal protein, milk protein, with a lot of branched-chain amino acids. So I was very happy to see that study, which very clearly and with a very defined setting showed that there is no induction of insulin resistance over that time with such a diet.
So that's very interesting, isn't it? Because you bring up how contrary some of these studies are, and it's not really surprising that the public and doctors are confused about what advice to give when actually science comes up with such diverse results on the same thing.
Well, this is one of the general problems. A public who's not so much trained in understanding science and hears this is good or this is bad. In Germany, they presently say milk is so bad it causes cancer, and which is really nonsense.
Or worse,
but people can't
one day,
interpret it.
yes,
Yeah.
or worse, one day, butter gives you cancer, and the next day, butter protects you from cancer. I don't
it's
think
good for your
people,
brain,
yeah, or good for your brain. Or my mother told me fish was good for my brain. So there are a lot of very conflicting ideas, and nutritional science has not had perhaps the rigorous science that that's been needed in the past. I think it's improved recently.
Yes, well, there are many studies now, and we kind of sort out the good and the bad guys. The problem is the hard outcomes, which would be death, cardiovascular disease, stroke, diabetes. You can only look at those in long-term studies, and you need huge studies. And to control nutrition over longer times is almost impossible. So I think for some of those things, we will never have a definite answer. And we can only approach that by these indirect markers, which do not really give us the hard endpoint. And epidemiology fails because, similar to vitamin D, in protein intake in Germany, the protein eaters are Wurst eaters, so they eat sausage, processed meat.
I'd never heard that
and
Germans eat Wurst.
Currywurst, and they have a behavioral pattern. They're the guys who are not so conscious about food. They eat very little vegetables, which is a risk factor also. And if you compare that then to vegetarians or even vegans, they drive bikes, they do all these healthy things, they choose foods, they eat a lot of plant food. And so these things cannot be sorted out by epidemiology.
And of course, I understand that if you have currywurst, you have to have chips. Is that
Sure.
right?
Yeah.
Well, there you are. So there are two negative studies there where it's a thumbs down for protein making a difference. It's a thumbs down for vitamin D making a difference. What else?
No, but for protein, this was not negative. So we should say protein still is on the positive list, depending on what you read.
The caveat.
So another topic there was the circadian rhythm.
This is fascinating.
Time-restricted feeding. There are many presentations here about what happens when you eat only during a 6 to 8 hour period during the day and you fast over the remaining time.
And this is a big popular thing going on out there in the outside the EASD, where people want to restrict calories, say after 6 o'clock at night, and only eat again. So you have a period of fasting effectively overnight.
Yeah. Well, so this is one aspect that you are fasting in between, but the second is when do you eat that? In the morning or in the evening? And we know from these clock studies, which have been done by a number of groups. This is Daniela Jakubowicz and Oren Froy from Israel who published that. And we also did quite a lot of work on it. And in healthy people, it's quite clear they are much more insulin sensitive in the morning than in the evening. And if you give the same meal in the morning, the increases in blood sugar are only 1/3 of the same meal in the evening. And this is because insulin does not compensate for a daytime-related insulin resistance. This may be different in people with diabetes who have higher insulin requirements in the morning, but this is not well studied. But so here the question was, do people do better if they have this circadian time-restricted feeding and eat in the morning and small dinner, big breakfast? And this was the case. Actually, in this study, people lost about 4 to 5 kilograms and had an improvement of basically all markers. The control group did not lose weight. And then, of course, the question arises, was it the weight loss or was it the circadian feeding? But still, it showed that it was not a prescribed weight loss, that people did quite well to lose weight over a period of a couple of months with this time-restricted feeding, and it helps people to control food intake. Normally, we eat about 8 times a day, little snacks in between, which is a very unfavorable pattern.
Or 12 times a day if you're at EASD.
Yeah, all these little things. But so this seems to be one of the problems, and time-restricted feeding helps you solve that. And studies are still underway, but it looks like it's really better to have your major meals at least in a time-restricted period, and perhaps the best would be in the morning. But this still needs to be shown in longer-term trials. But in short term, you can clearly improve metabolism in that way.
Okay, so if you're eating a lot of hotel breakfasts while you're at EASD, a large breakfast, don't feel so guilty. It's better then. But unfortunately, I suspect a lot of you are also eating dinners in the evening as well. Right, bad news. Okay, that's a fascinating piece of work. What else?
Let's see, I have to remember. One interesting thing was presented by an Australian group, by the group of Professor Horowitz, which was about, in fact, the glycemic index, or where in the gut food is taken up. So they did this very systematically with an infusion with a catheter, either in the proximal or distal small intestine. And they could show that this would have very different effects. On the one hand, on the release of the gut hormones, because proximally you release GIP, glucose-induced insulinomimetic peptide, and distally it's GLP-1. And the GIP seems to be a bad guy, which is also quite a discussion at present, but at least under the circumstances of normal food intake. And in this study, they showed that this will cause a drop in blood pressure in people postprandially, in people with diabetes, much less in healthy people. And many people feel bad after eating, and so this was one explanation. But the other thing is also that this change in gut hormones is also linked to improvements in metabolism. So if you have foods which are resorbed distally, which is all the healthy stuff like whole grain and so, or vegetables, which are slowly digested, then you do get less fatty liver, more beneficial profiles, and actually better satiety, and you usually eat less. So it kind of confirms what we thought about the glycemic index, but it adds this interesting aspect of blood pressure regulation. And I think we all have patients who complain that they feel so tired after eating, and one of the problems may be, in fact, this drop of blood pressure induced by rapidly absorbable carbohydrates.
How interesting. And actually, I bet there are a lot of diabetologists listening who will have had exactly that comment from their patients too. And now they know what the answer is.
Well, they should probably eat slowly digestible food and try a more healthy diet and probably smaller meals.
Very interesting. Anything else from this session?
Let's see.
I bet you're all thinking, I wish I'd been to that session.
Another one was, bariatric surgery is another big topic at present. And we know that there is a lot of diabetes remission if you lose more than 15 kilograms of body weight. And diabetes surgery then adds this aspect of the more rapid release of incretins. And in this study, they compared in a randomized prospective study, which are currently very few studies, the sleeve gastrectomy compared to Roux-en-Y gastric bypass. And they showed that the Roux-en-Y gastric bypass actually is more efficient and somewhat better, causes greater weight loss and an almost 80% reversal of diabetes, while the other was only 50%. So something which I also favor, in fact. I think the Roux-en-Y gastric bypass at present clearly does better than the gastric sleeve for patients who are obese and who have a good chance to reverse diabetes upon surgery.
So there was a fascinating session. What would be the one message that you would give to diabetologists to take home with them, the message that you would take home to your patients and the care of your patients?
Well, there were very diverse messages actually, but I think paying attention to food quality is one of the most important things which can have a big impact in diabetes, and to give recommendations best by somebody who's trained in doing that, by a trained dietitian, to the patients, and to make them aware and to test feeding strategies with them, like time-restricted feeding, high-protein diets, for instance, is a way to demonstrate to the patients how they can improve, and people accept it perhaps much better if they see that it really helps.
Fantastic. Thank you so much for talking to us. Obviously, a absolutely fascinating session and lots of really useful patient-orientated information coming out of it. And there's lots more.